pledge will be led by the gentlewoman from Texas, Ms. Johnson.
I'm here this morning just to address education. How do we know? Because the people have told us so. We represent the ideal way to alleviate the shortages is by ensuring that children of all races and both genders receive the basic grounding in science and mathematics that will prepare them to pursue careers as scientists, engineers, and technologists. Is it not time, then, for America to grow morally? For those who fear to answer this question, I will answer it for them. The time is now.
Now more than ever, what happens in Washington impacts us here in the Dallas-Fort Worth area. Your Congresswoman, Eddie Bernice Johnson, will help you understand what goes on inside the federal government and share perspectives from today's leading policymakers and opinion leaders. And now, your Congresswoman, Eddie Bernice Johnson.
Hello and welcome to the Capitol Report. Today we're going to talk about health care again, and I have Mr. Richard Kirsch of Healthcare for America Now, who joins me to discuss health care reform. Prior to joining the Healthcare for America Now, he spent 22 years as Executive Director of Citizen Action, which helped to provide affordable health coverage to 1 million working families in New York. We need him in Texas. In 2001, he was honored by Families USA as the National Healthcare Consumer Advocate of the Year. I know he can tell us a lot about health care in this country, but Healthcare for America Now is a national grassroots campaign that consists of more than 1,000 organizations in 46 states, and believe it or not, it includes Texas, that are committed to reforming health care. And if any state needs it, our state does. We have so many people uninsured. We have so many working people that are uninsured. So we know that we must do something. Where we are now is really not an option. It has to be improved. Welcome to the show, Mr. Kirsch.
It's wonderful to be with you here.
Tell me exactly how you are working now to get the message out.
Well, Healthcare for America Now is a grassroots organization. We got organizers in Texas and 46 states around the country, working with folks at the grassroots in their communities, in senior centers, in churches, in union halls, in neighborhoods, talking to people about the fact that we want to get a guarantee of quality, affordable health care for everyone. People should know that if you have a job, you should come to good health care. And even if you don't have a job, you should still be able to get health care you can afford. The point is, no one should go without health care. It's so important to our families. It's so important to our lives. It should be a basic right, and that's what we need Congress to do, and folks like you are working to do this year.
I'm having a lot of people contact me saying they really must have it this year, and we're trying, and I hope we can get it. I know that our public hospital has really had a huge amount of uncompensated care. They cannot continue to function in that manner, so we must do something. I know that the insurance companies are very anti this movement. However, if they would insure many of the people that are not insured now and stop dumping people out, we'd have it made, but that's not what's going on. And we need a big change, most especially in states like Texas, where you have a lot of new immigrants coming in, and they have no access to purchasing health care premiums. We must make that available to people in this country so that everyone can be responsible for themselves. I think they want to be responsible for themselves, but if they don't have a physician and don't know where to go, then they wait until they're sick, and sick care is the most expensive care. So I just, are you convinced in moving around in these 46 states that people really want it? We get so, the people who are able to buy ads on TV are very critical of some of the things that we're doing. But the people out there really needing and wanting and not getting compensated for any action are saying they're desperate for it.
People are so ready for this, and it's just everybody. Because if you have insurance, it's hard to afford it, the premiums are too high, they're charging you more out of pocket all the time. If you don't have coverage, you put off going to that doctor, and because you're scared you can't afford it, and if you end up in the emergency room, sicker, more expensive, and that's not the best way to care for folks. So people are really ready for this. And when we talk about giving a guarantee of quality, affordable health care for everyone, that means everyone. It means whether you have insurance, but it's hard to afford it, whether you don't have insurance and you really want it, but being sure you really can afford it. Because right now, so many times the premiums, premiums have gone up 5 times as much as wages in this country. Insurance companies keep driving premiums through the roof, charging you more at the same time for your prescription drugs or for a doctor's visit. We got to end that. We got to be sure that everybody has health care they can afford. If you get health care at work, you can afford it. And if your employer doesn't provide health coverage, you still can afford it.
Just recently I saw a couple on television who had a young baby about 6 or 7 months old. And just the most beautiful baby, a little plump.
Right.
But, growing up at that age, sometimes you'd rather see them kind of plump than not. Well, their insurance would not insure the baby because they said it's a pre-existing condition that the baby was obese. The baby was not a year old. Now, that is, to me, the extreme.
It's outrageous. These insurance companies will do anything to avoid covering anyone who actually might need care. So you're right. This was a little baby, a few months old. He was a plump baby. He was at the top end of the weight chart. He's only a few months old, and they wouldn't insure him. But they're looking to do that. And yet, at the same time, the chief executive of United Health, he got paid $57,000 an hour. So these insurance companies, they care about giving their CEOs millions or hundreds of millions of dollars in this case in salary, big profits, and they don't want to insure anybody who might need health care because that's a dime off their bottom line.
Well, you hear often people saying that your health care is great unless you get sick. And when you get sick, you have a problem. And it's so interesting that as long as there are young, working, healthy people, there is no problem in getting insurance. It might continue to go up, but they can get it. But when they really need it is when they have problems with health care. So it's just a puzzle to me why they would think so one-sided on this issue. People buy insurance, whether it's on their house, cars, or whatever, in case something happens. They don't buy insurance because they're going to get sick every day. But when they need it, if that's when it goes bad, then they've gained a lot of money before the people even get sick. And so it's just strange to me that they're not willing to give. And I've been told many times that they're spending $1 million a day to lobby against health care reform. I think it's unconscionable.
There's more than 1,700 insurance industry lobbyists on Capitol Hill up here. They're spending huge amounts of money to block reform or to be sure that if reform passes, it'll make them even richer. And as you say, when an insurance company covers someone who actually needs health care, it cuts into their bottom line. And so that's one of the reasons we need a choice of a public health insurance option, because the public health insurance option wouldn't be accountable to Wall Street. It'd be accountable to the public, and its mission wouldn't be to make the most amount of money. It'd be able to provide the best care for people. And this is the one thing the insurance industry hates, because they don't have to compete with the public health insurance option that'll put people before profits, that would force the insurance companies to lower their prices. So they're fighting tooth and nail to stop that public option.
And all of the insurance companies function about the same. So it's hard to say you're going to get a better one if you shift to another insurance company.
That's right. They all compete with each other to boost their profits and to turn patients down that need care. And the idea of a public health insurance option is to have a new kind of player in the market, one that actually is accountable to the public, again, not to Wall Street. And that's what they're definitely afraid of, because if that happened, they'd have to lower their prices, they'd have to put people first. They say people will leave them for the public insurance option. Well,
why are they afraid of it?
They're afraid of it, right.